New videos every day.
Today I want to talk a little bit about sexual health. Now, sexual health isn't something that a lot of patients will come in complaining about. It's just a subject that may be too embarrassing for the person. But there are three different ways that people can go about having sexual problems. One is just through a basic physical problem. Other ones can be through chemical problems, such as drug or nutritional deficiencies. And the other one is through emotional problems. Now, when we're talking about sexual health, I also want to include infertility in there because that's an issue that oftentimes we're able to help women with as well. This is Shannon, and in a minute she's going to help me to explain a little bit about some of the more physical problems that can lead to sexual problems or dysfunction or infertility problems. So let's go ahead and talk about the physical causes. Now, in some of the previous videos, I've actually spoke to you about how a subluxation or a pinched nerve in your lower back can actually cause problems. And that is one of the chief problems that people can run into. The nerve supply to those organs can be reduced, and that's causing some problems. So let me show you something here with Shannon real quick. Shannon, if you wouldn't mind stepping up here. So we're looking at Shannon's lower back right here, and I want you to kind of think about this lower back almost like a junction box where lots of big, heavy nerves come down off the spinal cord, and then millions of little nerves go out from that junction box. And where do they go? They go to the lady's ovaries. They go to the kidneys. They go to the bladder. They go to the colon. They go to the, if it would be a man, it would go to the penis or the testicles. So these nerves all come into the junction here and then fan out and go to the different areas. Now, when we have a physical problem in the lower back and those nerves have been pinched or compromised, then those particular organs cannot function properly. And then that can end up causing problems like PMS, premenstrual syndrome. It can cause infertility in the women due to the ovaries not getting the proper signal. The uterus can be compromised, which can often cause menstrual cycle problems as well. The colon can also be involved, which can end up causing constipation or irritable bowel syndrome, these kinds of things. The bladder can be affected, and we find that it oftentimes is in women, which can cause leaking to occur from the bladder when the lady will laugh, or oftentimes that can end up causing leaking there. We've also found in children sometimes bedwetting can occur if the nerves to the bladder have been compromised. So making sure that the spine is in the proper alignment and there are no mechanical difficulties in here is one of the chief ways that we can prevent sexual dysfunction as well as infertility problems and other issues that arise from any organ that is in the lower part of the spine here. Now, when we're talking about men, of course, impotence is a big problem for a lot of men. And if we mentioned earlier that the spine can act like a junction box with the nerves, big nerves coming in and little electrical signals coming out. Well, if you've ever thought about how a rheostat works or a dimmer switch works on a light bulb, you can actually take that rheostat or that dimmer switch and you can turn it down to where the electricity is just barely coming across that nerve or not at all. That can actually happen when there's a subluxation or a misalignment in the back area. So in the case of impotence, the signals to the penis have been reduced so significantly that it just doesn't work properly. And the effect of that for sexual dysfunction can be that the man is impotent, or that the woman cannot be sexually aroused, or that she has problems with lubrication, or lack of sensitivity there. So whether it's a man or a woman, a decreased nerve flow to those organs is going to have an adverse effect on their sex lives. So by simply pulling the pressure off of those nerves and restoring that normal flow, we can turn back up the volume so that people can enjoy a healthy, normal sex life once again. So I've got Shannon on the table. It's time for her adjustment. And I'm basically just going to go down through the spine and do an adjustment on each vertebra. And as I do, I'll explain a little bit about what I'm doing and also how that particular vertebra affects other organs in the body. Okay, now a lot of people, when they come to see me, they actually have pain right here where my finger is. And this is actually where the last vertebra in the spine is located. We call it the L5 or lumbar 5 vertebra. And as I'm going to put a little bit of stretch on that area there, we're actually helping to take some of the pressure off of that nerve. The patient actually thinks that feels really pretty good when we do that. And this area of the spine can have a lot to do with the circulation in the legs. People who have swollen ankles or problems in their ankles, this can affect that. And as we move up through the different areas of the spine, as we move up a little bit higher, these are some of the nerves that start to affect the bladder. A lot of women especially can have problems with leaky bladders, or they can have also troubles, menstrual troubles. These nerves also go to the sex organs, the bladder, the uterus. Miscarriages can result from problems in this area as well. In children, we often see bedwetting as a problem that has happened. And we've had many children who've completely got over bedwetting just by simply taking some of the pressure off of these nerves here. PMS type symptoms, as we've said, change of life symptoms, sexual dysfunction, all can occur from this area of the spine. And as we move up a little bit further, up into the very upper reaches of the lower portion of the back, we run into nerves that go into the colon. And problems in that area, of course, can result in constipation or diarrhea. Some sorts of colon dysfunction can occur there. So as you can see, this whole lower back area directly affects the health of all of the organs here in the lower portion of the body, even to include the kidneys. So don't forget that as part of your healthcare regimen. Keep that spine as free from interference as you possibly can. If you're having some trouble with sexual dysfunction or any of the problems that we've talked about in this video, consult with a good chiropractor in your area who can help you with these difficulties. So you may already have lower back issues, and it's important to know and to be able to correlate those issues with your sexual health, with also the colon health, the health of the bladder. Basically any organ that's in the lower abdominal area or the pelvic region can be affected by the lower back. But also it's important to know that you may have no lower back problems or pain sensations at all, and those organs can still be being affected by a nerve that's being pinched in your lower back. That nerve just simply may not contain pain sensors, and you may have no idea that you have any back problems at all, other than you may have some sort of sexual dysfunction or colon problem or leaky bladder or those kinds of things. So don't rule out back pain or back problems, rather, just because you don't have any back pain associated with it. And if you do have back pain, you need to be alerted to the fact that those kind of things can progress and come into being as a result of that. Now, in my practice, nutrition, of course, plays a very big role, and nutritional deficiencies can also lead to problems with the female as well as the male reproductive systems. So we address those as well. Eating lots of refined sugars and grains and problems like that over a long enough period of time can actually exhaust some of the glands that are responsible for your sexual health. So finding a good chiropractor or a practitioner who is very well versed in nutrition may also prove to be very valuable to you. Again, a lot of people are a little bit embarrassed to talk to their practitioner about their sexual health. Well, don't be. They're trained. They want to help you. And to get that part of your life back and restored is a big part of life. So go ahead and confidently talk to your practitioner. They want to help you. You want to get the help. Also, if you have any questions about anything that we've gone over today or comments, please leave those. And if you have any future videos that you'd like to see or topics that you'd like to know about, please leave those as well as a comment, and we'll be glad to see if we can help you with that. So thank you for watching, and I will see you later.